Hey everyone, I'm Brett Bays, and today I'm going to show you how to go through and patch your horse safely and effectively. These protocols that I'm going to show you were designed for your safety, so please pay attention to where my body's positioned as I'm moving around through this horse. What we have here is a 20-year-old head horse. He does have some issues we already know with ring bone and some other things going on, but mainly today, since the patches work best on soft tissue, we're going to go through and show you, starting in the poll and working our way to the back, how to evaluate the horse. When you are patching your horse, you're going to want to use approximately 5 pounds of pressure. You're going to start off in the poll. You're going to check on either side of the poll using your hands like this. Now you may have noticed that I have patches attached to the back of my hands. This is for today's video. It just makes it easy for me to peel them off and stick them where we need to put them at. When I check the poll, the first thing that we want to look for if we have pain is for the head to fly up or the horse to move off or move away. It's important to note that a lot of horses actually are trained as a cue. If you apply pressure to the poll, they'll drop their head to be bridled. That's not a sign of pain, okay? They've been taught that. Again, you're looking for that head to move up or move away, okay? So I'm gonna go right here in this poll. I'm gonna apply pressure in about 3 different spots. It's gonna be right about where your halter, your bridle comes over the top of that poll. Right in there is the area you're checking. He's not moving on us, he's good there. But if I did have to put a patch there, I would put it right here, just right above this bone they have that protrudes out the side a little bit. Right there, I'd put a white patch on the right and a tan patch on the left. The reason that we're doing the white patch on the right and the tan patch on the left is because of polarity. Typically, the right side of the horse and the right side of your body are the positive side. So that's why we would put the white patch on the right side, the tan patch on the left side, which would be the negative. Every once in a great while, you will have a horse that is reverse polarity. There's no real clear reason as to what causes reverse polarity. Some say that it is due to a specific trauma that has happened at some point in the life of that horse. So effectively what that means for you is that if you patch your horse, white on the right, tan on the left, and it doesn't work, you're going to need to flip-flop your patches. That does not happen very often, but it is something to keep in mind when you're working with your horse. So again, we've checked him in the poll, and he's fine. We don't have any pain. We showed you the spot that you would go to there. Next, you're going to want to move to your neck. Okay, this is all of your, effectively, if you think of this horse like a car, this is all your power steering, from right here in the poll to the front part of the withers. Okay, you're going to come right down the neck, with even consistent pressure on both sides of the neck. You're going to use both hands. The reason you're using that even consistent pressure is if you have a horse like this, a rope horse that is broke to neck rein, and you go heavy one hand versus the other, with just your one hand on one side, that horse could think you're just asking him to move off away from you, just doing what he's been taught to do. To truly get a signal of pain, you want to use both hands with that even consistent pressure. You're going to check 3 spots down the neck. You're going to take care to stay out of the esophagus area down here. You're going to stay up on the muscle, okay? This is your position you're going to be in, and you're going to run right down the top line of the neck. Here, we had a little bit of a raise right there. What we're looking for, again, is that head to lift up or for him to move off. That little bit of raise there. Now we've got it twice. So to me, that's a sign that we have a little bit of pain right there. Once was just kind of, he doesn't know me, but twice is usually an indication of pain. So that spot was right here. We'll go ahead and stick it right there. And then I'll take my tan patch and I'm going to get it as close as I can where it's straight across on the other side of the neck. That's the wonderful thing about these patches. You don't have to get them specifically right on a spot. They do have an area that they work out from when they're increasing that circulation and decreasing that inflammation in the muscle. So it makes it very forgiving. You would just want to get them approximately lateral from one another. Continue your line down the neck, in the middle, come down the bottom. He looks pretty good through here. He's just kind of feeling me come down, tickling him a little bit. From there, you want to move to your front shoulder. Okay, when you're checking that front shoulder, you're going to start up high, up here, not on the bone, not on that shoulder blade. You're going to be right here in the muscle between the neck and the shoulder blade. Come right down through that line. You're looking for the horse to back off or move away. Continue your line, go to the outside of the pectoral muscle, right here. Keep your pressure all the way down underneath. Typically, your head horses, cutting horses, any horse that uses their front end a lot, they can get sore in this area. If they've been taught to correctly pick themselves up and absorb the shock of a steer hitting the end of the rope and then move off, they're not going to usually be sore. But if you have a head horse that takes a lot of that hit on the back end, you'll find that they're very sore right here because they're bracing against that steer hitting the end of the rope. He looks pretty good. He didn't back off through here anywhere, so I think he's good there. Next, we're going to move to the girth area. Signs here are if you have a horse that gets really cinchy or girthy when you're tightening up that girth and they're coming around trying to nip and bite at you. That could be a sign that you have something going on in this area here. So you're going to want to check this area. It usually takes about 2 good swipes down through this area. I'm going to come right through here. I'm looking for him to move off sideways or try and come around and bite me or swish the tail. Those are all signs of pain. If you're a horse person, it's usually pretty obvious what your signs of pain are. He looks good there. Now I'm going to come up and work on this bladder meridian. Okay, I am not a vet. I'm not a chiropractor, as we mentioned earlier. I am not trained to work in the spine area or mess with the spine or manipulate it. I work in the bladder meridian, which is about 4-finger width down from the spine, and it runs parallel with it all the way through the back side of the horse, down into the back feet, down the back of the hamstrings. Okay, that bladder meridian is a great sounding board for any issues that may be going on in the horse. All your energy channels are tied to that meridian. So when you do get pain here, you will see the horse drop the back, and when you patch, you get results fairly quick with a very high percentage. You'll know that you've had success when that horse drops the head, starts licking the lips, and gives us some type of endorphin release. Okay, so I got my 4-finger width. Now my 4-finger width might not be your 4-finger width. Run right down that line. You're looking for him to drop. Here's a spot where he dropped right here. So I take my white patch, put it on him there. And I'll show you guys, I can move around behind the horse. If I trust the horse and I know what's going on safety-wise, and I can come over here and look and put my tan patch. Or you can also, if you're in this position and you patch here, you can also reach across and patch on the other side as well. We've already got him over here yawning and licking his lips a little bit. Now you're going to continue your line right on through down the back side of this bladder meridian and go around and check the hamstrings. I want you to notice here how I'm standing. Your stop line is that horse's flank. You do not want to move past that flank towards his rear end. You're in the danger zone at that point if you get one that is sore. And believe me, if you get a horse that is sore, they're going to pick up that hamstring and hold that leg, or they're going to fire out and kick at you. So you want to stay out of that danger zone. Don't move past the flank. I'm using my offside hand here. I'm going to continue that line, that even pressure going around. When I get here, there's the leg pick up there. I will simply take my white patch. I'm going to put it on my left hand, on my thumb, just like this. So when I continue my line, the idea is that when I get to that sore spot where he picks up, I can just then flip this patch right in there and be out of the way. I'm going to move around. I'm going to be in the same position again right here. I'll have this patch on my thumb, but now I'm using my right hand instead of my left hand because I'm on the opposite side. Continue that same motion around. I'm looking for a hamstring there. I stick him in, I'm out. Okay, from that point, we've addressed his back area. The low back area is where we had some patches placed. We addressed the hamstrings back there. Give those a few minutes to work. Now we're going to move to the stifle area. This is a very common place, no matter what the discipline is, that horses do get sore. It could be dressage horses, it could be rodeo horses, barrel racing, whatever it may be. This is an area that they use quite a bit for most of the work that they're doing when they're moving around. To check stifles, I want to stress to you, please use caution and safety. Please try to use this method that I'm going to teach you right now. Also, please try to have another person present when you are checking stifles. If you don't have another person to hold your horse, please make sure that you tie them on a very short lead, because if a horse is sore in the stifles, they're going to try and come around with the head and bite you while at the same time cow kicking out sideways. So you can see where you can put yourself in a position where you may get harmed very quickly. And the horse is just reacting to pain. They're not maliciously trying to do it. So what you want to do, if you have someone to hold the horse, I'm going to ask my good friend Paco here, who's helping us out. Paco, if you could come over here, hold his head tight to where he can't come around and bite me. Okay? Right there's perfect, thank you. You're going to want to hold his head right there. You, as the person doing the patching, notice my body position. I'm on his right side here. I'm going to put my left hand on the neck so I can feel that head coming towards me. I'm going to use my right hand to reach back and evaluate the stifle. What I'm looking for is for that leg to pick up or him to kick out, move away, try and bite, tail swish, anything like that. I'm going to come down on the inside of that stifle. He's moving away. So what I will now do is take my tan patch. Stifles are a little bit different. We're going away from the white on the right. I'll take my tan patch, put it on my finger like this on my right hand. Okay. Go back to my position for safety. I'm going to go right into that stifle. I put my tan patch right on it. Now, you're going to take your white patch and you're going to go just bilaterally to the inside of that. I've got it hooked right on my right thumb, same technique we use when patching hamstrings. The idea is for me to get inside and patch and get out. Okay, so I'm just going to reach to the inside and stick that patch right on his inside. This old boy's got a sore right leg, right side. Okay, what we're going to do here is we're going to move him back over this way a little bit so I'm in safety, because I don't want to get pinned against the stalls right here. Pay attention to those types of things if you're working in a breezeway in a barn like this. Not so much of an issue if you're tied outside with open space around you, but we're going to go ahead and move him over a little bit here. Ask him to move back. Okay, now we're going to check that offside stifle. We already patched his right hand stifle. We're on the left side now. You're going to assume that same position. Paco, please make sure his head doesn't come around on me. I'm going to put the tan patch right on the pain. He's quivering. Now we had a release right there out the back end. That's effectively their version of saying, wow, that feels really good. You can hear him licking his lips up here. And I've got another white patch to the inside right here. Again, forgiving, you can get them fairly close in that area and you're good. Okay, so we've patched him here in the low back. We've got both hamstrings and we've got both stifles. At this point, we've got 4, 5 sets if we count his neck. The max you're going to want to do is 6 sets. What I'm going to go do now is I'm just going to go back through and check him, see if that pain's moved or if we've addressed it. I'll just continue my line right through here. We have no drop in the back. He's very nice and soft. Through here, he's not tight in the muscle like he was before. I continue my line around. I get to this hamstring. Can actually apply pressure to it. He's not picking up that leg or anything else. I got my hand right here. Come down to that stifle. We got nothing there. And on the other side, we just want to check that as well. All right, so I'm going to go ahead and check him back here in this low back on his left side. We've got no drop here. Come around, check his hamstring, nothing there. Checking the stifle, nothing there on that side. So we're good all the way around. Okay, guys, so that is your basic patching protocols for patching your horse. If you have any more questions, please contact customer service, and we have some more advanced videos that address specific things like legs.
LifeWave does not diagnose or treat any medical conditions, and we strongly urge you to contact your normal veterinarian for any questions you may have.
The protocols that we show in these videos are tested and proven to help you manage and identify pain within your horse. They don't mask or block pain in any way.
Horses are inherently dangerous creatures, so we strongly urge you to take care at protecting yourself and your horse while you're patching.